Sister Peter Claver in particular, I think, really saw that the needs of the community and the people would dictate what our needs would be in serving the people. So she helped establish the CHAS clinics because there was the need in Spokane. She worked in collaboration with others. She helped establish the clinic at the House of Charity. And the sense of mission is that we also are all sent out. It could be out into our neighborhood. It could be out into our region. It could be out into our country. It could be out into our world.
My involvement probably started in the early 80s. It became very clear that, especially for adults, low-income adults, dental coverage just wasn't there. So in 1985, we ended up working with the dental assisting group at the SCC and with the hygiene students from Easterns. And they worked every Wednesday night with no reimbursement. And to do that for 10 to 12 years, which is what we did prior to it folding into CHAS, is pretty remarkable. I mean, it really speaks to the heart of the dental community. Adult dental for low income is still a huge problem. There are really 3 clinics that take the majority of the low income adults. The CHAS clinic, obviously, the Riverstone Clinic, which is part of the Yakima Valley Farm Workers Organization, and the IDEA Clinic, which is a volunteer clinic run by the Spokane District Dental Society within the Northeast Community Center. Most of the clinics have sliding fee scales, so it's based upon a person's ability to pay, and it may be nothing or up to 25% or so of what would usually be charged. There was one person that I recall in particular, and she was new to the community, had several kids that were under the age of like 6, and she would drag them in to the clinic on Wednesday nights to get her service, and as she was telling her stories, it was just amazing what she had gone through to get care for her kids, but neglected care for herself. And when she heard about this clinic, she almost cried. We were able to give her the help that she had put off for herself. That certainly fit with the Sisters of Providence and with Sister Peter Claver's missions and her vision as well.
The striking thing for me about Sister Peter Claver and the mission of Providence has always been that they do things for the community. So with the projects that I've been involved with Project Access and with prescription assistance here in Spokane, they were some of the first to fund this, knowing that it would be community outreach. Throughout my practice, I really had the luxury of taking care of anybody who came to me. The hospital, never turned anybody away for any reason. Once I retired, I worked at the House of Charity, where I could see the outreach. And I went away to the Kennedy School of Government to kind of educate myself on broader plans and encountered Project Access there and brought that concept back with me. The idea of bringing together people's charities can build a very powerful platform of combining all this physician charity, hospital charity to really take care of people who at that time had really no other resource. Even though people now may have insurance, there are very high co-pays, medicines cost a great deal. We're able to provide $2 million of pharmaceuticals in Eastern Washington, and overall in the history about $14.5 million since we started to this community. And that's all outside money coming into this community for healthcare. What I've been fortunate in being able to do is kind of see these areas of charity, either charitable desire or grants from companies and so forth, and to bring them together in an organized fashion. And I think we get so much more from that. It really is, I mean, one person stepping in and putting in what they can do adds so much to what everybody else can do.
As Sister Peter Claver became the leader at Sacred Heart, she knew that that whole sense of mission impacted our local region as well as across the world. As a Sister of Providence, we had international mission places all along. Early on, we established here, following Sister Peter Claver's death, we established a way to be able to take our medical supplies, collect those, sort them, and send those kinds of things to the international missions. But we first also then looked to the local community. And like Sister Peter Claver would say, well, what is there here that we have to do in our local community? Usually the first or second Saturday of the month, volunteers come here to help sort through all the things that we've collected. Last year, we sent over 11,000 pounds of medical supplies to Lacey, Washington. It is from there that the Providence International collection and ability to send medical supplies, that mission sense of beyond our borders, really took deep root. We have regularly several groups that go on medical mission trips.
Hearts in Motion, they take about 26, 27 different teams down every year. The team that I go with is the plastic surgery team that goes in March. Of that core group, we also have people that go out and do construction. They do medical clinics, dental clinics, feeding services. We keep going to the same community every year, so there's a lot of follow-up care that we can give. There's a lot of continuity in the programs that Hearts in Motion has started. So the first time going down was a real eye-opener for me. The families are so brave to hand over their children to complete strangers. We ended up arranging for one of the boys down there that had a severe clubfoot. He was 18 at the time. And so Healing the Children arranged for him to come up. He stayed with us for a year while Shriners did multiple surgeries on him.
When our modern medical mission teams go now, they don't go just to do a few surgical procedures. They teach those who are there to do the services.
The last 2 years, we've gotten to go to a private hospital in Zacapa, which is the region where we always are. And it's owned by a surgeon down there. And at the end of our mission, which was the first time we had been there and he had seen us and what we do, he said, this is what this hospital should have been all along. We should have been taking care of the poor. And that was really heart-wrenching for us because it made us feel like over all these years and the effort we put into it, that he could see a way to take care of his own people too. And it was wonderful. We are just lucky to be in the United States where care is so abundant. And I'm glad that we're in a position where we can take that care to other people. I don't think anybody can go down and give care to people who are so gracious without being infected with the notion of serving.
One of the things I think that's really important for us to recognize is that those that we honor tonight are all in their own way missionaries. They do the mission. They provide for needs from others, and some of them at a distance. I think in the heart of Sister Peter Claver, their hearts beat the same, so we honor them tonight.